Diabetes mellitus refers to a group of diseases that affect how the body uses blood sugar, glucose. Glucose is an important source of energy for the cells that make up the muscles and tissues. It's also the brain's main source of fuel. The main cause of diabetes varies by type, but no matter what type of diabetes you have, it can lead to excess sugar in the blood. Too much sugar in the blood can lead to serious health problems.
Symptoms. Diabetes symptoms depend on how high your blood sugar is. Some people, especially if they have prediabetes, gestational diabetes, or type 2 diabetes, may not have symptoms. In type 1 diabetes, symptoms tend to come on quickly and be more severe. Some of the symptoms of type 1 diabetes and type 2 diabetes are feeling more thirsty than usual, urinating often, losing weight without trying, presence of ketones in the urine. Ketones are a byproduct of the breakdown of muscle and fat that happens when there's not enough available insulin. Feeling tired and weak, feeling irritable or having other mood changes, having blurry vision, having slow-healing sores, getting a lot of infections such as gum, skin, and vaginal infections. Type 1 diabetes can start at any age, but it often starts during childhood or teen years. Type 2 diabetes, the more common type, can develop at any age. Type 2 diabetes is more common in people older than 40, but type 2 diabetes in children is increasing.
Visit your GP as soon as possible if you experience the main symptoms of diabetes, which include feeling very thirsty, peeing more frequently than usual, particularly at night, feeling very tired, weight loss, and loss of muscle bulk. Weight loss is common in people with type 1 diabetes when it first develops and before it's treated, but it's less common in people with type 2 diabetes.
The amount of sugar in the blood is controlled by a hormone called insulin, which is produced by the pancreas, a gland behind the stomach. When food is digested and enters your bloodstream, insulin moves glucose out of the blood and into cells, where it's broken down to produce energy. However, if you have diabetes, your body is unable to break down glucose into energy. This is because there's either not enough insulin to move the glucose, or the insulin produced does not work properly. There are no lifestyle changes you can make to lower your risk of type 1 diabetes. You can reduce the risk of type 2 diabetes through healthy eating, regular exercise, and achieving a healthy body weight. You may be more at risk of type 2 diabetes if you are living with overweight or obesity, do not have a healthy diet, have a family history of type 2 diabetes, are of Asian, Black African, or African Caribbean origin, take certain medicines such as steroids for a long time, have high blood pressure, have had gestational diabetes during pregnancy, living with diabetes. If you're diagnosed with diabetes, you'll need to eat healthily, take regular exercise, and have regular checks, including blood tests. You can use the BMI Healthy Weight Calculator to check whether you're a healthy weight. Try to quit smoking if you smoke, and cut down on alcohol. People diagnosed with type 1 diabetes also require regular insulin injections for the rest of their life. Type 2 diabetes can get worse over time, and people living with type 2 diabetes often need medicine, usually in the form of tablets or injections. However, some people can put their type 2 diabetes into remission by losing weight, where their blood sugar is reduced below the diabetes range. Some people are able to do this through a low-calorie diet, but this is not suitable for everyone, so it's important to get medical advice first.
Screening, which includes a 30-minute check to examine the back of the eyes, is a way of diagnosing diabetic retinopathy and detecting the condition early where possible so it can be treated more effectively. In many people, this can stop it affecting their vision or reduce the chance of it getting worse. It's important to see a doctor if you notice any problems with your eyesight. Do not wait for your next screening appointment.
Diabetes can damage the nerves in your feet and cause a loss of feeling. It can also reduce the blood supply to your feet. This means you may not notice if your foot is sore or injured, and foot injuries do not heal as well. This can lead to ulcers and infections, and sometimes amputations can be needed in serious cases. Adults with diabetes should have their feet checked every year by a healthcare professional. It's important to see a healthcare professional as soon as possible if you notice any problems with your feet. Many people have blood sugar levels above the normal range, but not high enough to be diagnosed as having diabetes. This is known as non-diabetic hyperglycemia, or prediabetes. People with non-diabetic hyperglycemia are at greater risk of developing type 2 diabetes, but the risk can be reduced through lifestyle changes. If you have non-diabetic hyperglycemia, you may be eligible for the NHS Diabetes Prevention Program. The program helps people make lasting lifestyle changes and has been shown to help prevent type 2 diabetes. People with non-diabetic hyperglycemia are also recommended to have a blood test every year to monitor their blood sugar levels. It's very important for diabetes to be diagnosed as early as possible because it's likely to get worse if left untreated and can cause long-term health problems.